Right now, while you're watching this, a baby somewhere on Earth is being born using a needle, a petri dish, and a process that didn't exist for any human being before 1978. 1 in every 36 babies born today started this way, and almost nobody who watches it happen actually understands what's going on inside that dish. So, let's open it up. Here's a number that sounds almost impossible. Every woman is born with somewhere between 6 and 7 million eggs already inside her. More eggs than she will ever need, ever use, or ever even ovulate in an entire lifetime. By the time puberty arrives, that number has already dropped to around 300,000. From there, only about 300 to 400 of those eggs will ever actually be released during her reproductive years. The rest simply disappear in a process scientists still don't fully understand, called follicular atresia. That's the raw material IVF is working with. And it's also exactly why age matters so much in fertility, more than almost any other single factor. So, how does one egg out of hundreds of thousands actually get chosen? It starts in an organ you probably wouldn't expect, the brain. About 2 weeks before an egg is ready, the brain's pituitary gland releases a hormone called FSH. That hormone travels down to the ovary and wakes up a small group of follicles. Usually, somewhere between 5 and 20 of them begin growing at the same time. But here's the catch. Almost none of them make it through a kind of biological elimination round. One follicle usually pulls ahead, while the others shrink back down. The winner keeps growing, producing estrogen, until estrogen reaches a tipping point that triggers a hormone surge back in the brain. And that surge is what actually causes ovulation, releasing the egg about a day and a half later. Once that egg is released, it faces a brutal deadline. Fertilization has to happen within about 24 hours, or the egg dies and the entire month resets. And even if sperm arrives in time, the egg isn't an easy target. It's wrapped in a protective shell called the zona pellucida, designed specifically to let exactly one sperm cell through and block every other one trying to get in. Out of the roughly 100 million sperm released in a single ejaculation, fewer than 100 will ever get close. That's the natural version. Now here's where things get strange, because IVF doesn't try to copy that process exactly. It tries to break the bottleneck on purpose. Instead of letting the body choose one winning follicle and discard the rest, doctors flood the system with FSH at levels far above what the body would naturally produce. The goal isn't one egg, it's 10, 15, sometimes even more, all maturing at the same time. Once they're ready, a doctor retrieves them using a thin needle guided by ultrasound, while the patient is lightly sedated. The entire procedure usually takes less than half an hour, but here's a number almost nobody talks about. Retrieving 15 eggs does not mean 15 chances at a baby. On average, only about 70% of retrieved mature eggs go on to fertilize successfully. Of those that do fertilize, only about half develop into a usable embryo. So, out of 15 eggs, you might realistically end up with only 4 or 5 embryos. And that's before anyone even starts talking about genetic quality. Fertilization itself happens in one of 2 ways. Either the eggs are mixed in a dish with thousands of sperm and left to fertilize on their own, much like they would inside the body, or when sperm quality is a concern, an embryologist uses a microscope and a needle thinner than a human hair to inject a single sperm directly into the egg. It's called ICSI, and today, it's used in the majority of IVF cycles worldwide, often even when there's no obvious sperm problem at all. The embryos that survive are watched obsessively. Modern laboratories use incubators with built-in cameras that capture a photo every few minutes, tracking every cell division without ever opening the dish. By day 3, a healthy embryo has usually divided into about 8 cells. By day 5, it has become a blastocyst, a structure made up of hundreds of cells that has already begun organizing into the tissues that will eventually become a baby and a placenta. Many clinics now wait the full 5 days before transfer, because blastocysts that make it that far have noticeably better odds of implanting successfully. And here's a fact that surprises almost everyone, including many doctors from decades ago. IVF appears to make identical twins more likely, not fraternal twins from transferring two embryos. Actual identical twins, created when a single embryo splits into two after transfer. Researchers still aren't completely sure why, but the leading theory points to some of the same laboratory techniques, such as single sperm injection, that make IVF possible in the first place. Once an embryo is selected, sometimes after genetic screening to rule out chromosomal abnormalities, it's transferred into the uterus through a thin catheter. No anesthesia required. Then comes the part patients often describe as the hardest. A 2-week wait before a blood test can reveal whether it worked. No needle, no surgery. Nothing in the entire process feels as long as those 14 days. Now for the odds, in plain numbers. For women under 35 using their own eggs, live birth rates per cycle now sit at around 40%, sometimes higher depending on the clinic. After 35, those odds begin to decline steadily. And by the early 40s, many patients turn to donor eggs, where success rates depend far less on the recipient's age. There's also one statistic that has changed dramatically since the early days of IVF. Today, more than 97% of IVF births are single babies. Twins account for only about 2.6%, and triplets have fallen to roughly 4 in every 10,000 births, a tiny fraction of what they once were when doctors routinely transferred multiple embryos simply to improve the odds. So let's go back to that first number, 1 in 36 babies. Just over 4 decades ago, that number was 0. Louise Brown, the first baby ever born through IVF back in 1978, is now in her late 40s, and she has 2 children of her own, conceived the completely ordinary, natural way. No fertility clinic, no needles, no laboratory, which might be the strangest twist in this entire story. The technology built to create life in a dish ultimately produces people whose own bodies function exactly like everyone else's. The procedure that once made front-page news for creating a single child now happens quietly and constantly, every 35 seconds, somewhere on Earth. And most people walking past those babies on the street will never know which ones started in a dish and which ones didn't.